gentlemen, boys and girls, here, Dr. Larry Boucher. Let's take a break from COVID for a minute. We need to talk about something important. Have you seen this? Oh, I want to put a lot of words in front of it. Stupid Tik Tok Benadryl overdose challenge. Somebody's died from this already. These young people are trying to overdose on Benadryl, common allergy medication, so that they can hallucinate. What happens is you take too much, you can get into real trouble. And the reason I'm coming to you talking about this, we're starting to see this in the ER. This is a real thing among young people. I've seen countless suicide attempts in my career. It's sad, it's unfortunate, it's not getting any less with COVID, but I've never seen someone try to kill themselves with Benadryl. A recent case where they used Benadryl, taking 50 to 100 times the dose, had all these complications with it, altered mental status, confusion, heart rate was off the charts, seizure. Luckily, they were in the hospital and were able to be admitted to the ICU, cared for appropriately with an optimistic prognosis. But if somebody would have if they would have had a seizure from this Benadryl overdose at home, they could have died. They very easily could have died. This is serious stuff. So we're going to talk about what is Benadryl, what do we use it for, what's the mechanism, how does it work, and how does this overdose result in these serious problems? And is this like a good recreational drug? The answer is no. That there isn't like a pleasant euphoria of overdosing from this. It's not a very pleasant thing, and it's too risky, as we're starting to see. Don't do it yourself. If you have kids, talk to your kids about it. This is not a safe drug. Totally different topic about whether to get in recreational drug use or not. We're not going to go there, but this one, no good. I would get this stuff out of your house, honestly. Don't do it. It's not worth it. I don't want anybody else to die from this. So let's talk about Benadryl. I got 3 examples for you right here. Diphenhydramine is the generic name of the trade name Benadryl. I think Benadryl is Johnson & Johnson. What do you use this for? You probably used this before, right? Allergies. So you get allergy symptoms in your nose and your eyes in allergy season, or you get a rash, like hives. For me, when I have patients that come into the ER and they have hives, they pop up, sometimes related to food, sometimes you don't know. Benadryl is a really good medicine to get the hives to go away. That's the #1 medicine I use in the ER for hives. For a normal adult, 25 milligrams is typical. Some people will do 50 milligrams. As you go up, you're going to get more side effects. What's the most common side effect with Benadryl or diphenhydramine? It's sedation or sleepiness. So this one, look at this. You've probably seen these. Nighttime sleep aid, right? It's 50 milligrams of diphenhydramine. Same thing as Benadryl. That's all it is. There's nothing else in this but probably a little sugar to make it taste like berry. Nighttime sleep aid. So Benadryl is a common over-the-counter medication used for sleep. Children's allergy relief. These are actually, I just pulled these out of my medicine cabinet. Apparently I've needed these before for Ellie, for my daughter. 12.5 milligrams. Make sure you dose it according to a child's age and weight. Common medications, right? So a lot of people have them in the house. What is Benadryl? It's the classic antihistamine. Don't get freaked out by histamine. You've probably heard that before. When we get an allergen in our system, one of the body's immune system responses is to release histamine, which causes inflammation. And inflammation brings white blood cells. It brings our defenses to an area. And what happens? It swells, it can get itchy and red. That's actually a normal inflammation process. Now, when your body is reacting to a benign substance like pollen out in the world that's not going to hurt you in any significant way, these are called allergies, allergic reactions. Your body immune system is actually a little bit off. It's identifying something that's foreign but not harmful. And so in those cases, we take the medications like this, an antihistamine, to block the histamine, to shut that pathway down, make the itch go away, the redness, the swelling. That's the treatment, right? That's typically what we use Benadryl for. So what happens at increasing doses? Like I said, sedation is a known side effect of Benadryl. It's actually one of the things we use the medicine for. So Benadryl, it's 2 things. It's an antihistamine, which we talked about, at increasing doses, Benadryl is going to have what we call anticholinergic side effects. Don't get freaked out by that. I want to explain what that is, okay? Acetylcholine is the neurotransmitter, the key neurotransmitter of the parasympathetic nervous system. Let's talk about the parasympathetic nervous system. We know what the sympathetic nervous system is. That's like the adrenaline fight or flight. That's like you're ready to fight the bear and run away. This is like what's going on when you're in athletics and you're exercise, all that stuff, right? That's adrenaline. Parasympathetics is the opposite of that. So this is a part of the nervous system where you're relaxing and you're chill and your body is digesting and all of that stuff. So if at higher doses, Benadryl blocks the parasympathetic nervous system. So the way that I think of it is, if it's blocking the relaxation or rest part of our nervous system, then it's like triggering us to go more towards fight or flight. And that's the basic thing that we see with increased doses of Benadryl. People are much more kind of adrenaline stimulated is the way that I kind of think about it. Some of the specific manifestations that we see when you're fight or flight, you're sweating, you're whatever, and so it blocks the sweating. So people's skin gets red, dry, hot. Again, like when you're in relaxation, you're able to go to the bathroom. So increased dose of Benadryl can cause inability to pee, constipation, and then it also acts centrally on your central nervous system acetylcholine receptors, leading to all kind of agitation, delirium, hallucinations. This is what they're trying to achieve. Altered mental status, seizures. Okay, this thing can be pretty dangerous. Additionally, you think about your heart. What's your heart when you're relaxing? The heart rate is chill. You block the neurotransmitter that says, hey, keep chilling, keep relaxing. You block that and your heart rate's gonna go up. And that can get into dangerous territory with heart arrhythmias, irregular heartbeats. This is not a safe drug of recreation for fun and to abuse, okay? So what are the treatments? So if you come on somebody that's had this, number one, this is a go to the ER right away. If you get there early enough, meaning within 30 minutes or an hour, we can give what's called activated charcoal. They drink it, it's a little slurry, drink it, or we can put a tube down and deliver it through the tube, and that'll bind the medication and pull it out of the stomach so that it doesn't all absorb. And that matters if somebody takes a whole bunch of pills. That's commonly something, if we get to them early enough, we can do that. But it's time dependent. You don't give that at 4 hours because most of the time there's not any medication left in the stomach to bind. So number one is we get them in there for that. Two, stabilize the system, make sure they don't need life support, including a ventilator, all that kind of stuff. Commonly, we give fluids. Remember, we talked about the heart, how it's toxic on the heart, and the heart can kind of beat out of control. So we very slightly alkalinize the blood, adding bicarbonate, a little bit of base. We make the blood a little bit less acidic. Tip that pH a little bit. That stabilizes the heart. We'll monitor the EKG and things very closely like that. If somebody's very uncomfortable, they're in the middle of this delirium and all this stuff, we can medicate them with Ativan, with sedatives to kind of chill them out. And then you wait, it's about 24 hours or so for the drug to get out of the system. So it does take some time. Typically Benadryl lasts maybe 4 or 6 hours, so it's not like it has a super long half-life, but it is going to take a few cycles to get out of the system. And when you're dealing with such high concentration, people are taking, if a normal dose is 25 milligrams or 50 milligrams, if people are taking 2,000 milligrams or 3,000 milligrams, it's going to take a little more time to be metabolized and get out of the system. So that's the treatment. If you come upon somebody who has this, go to the ER immediately, call an ambulance, and let the professionals like us do everything that we can do to make sure this person is safe and stabilized. So that's how these common medications sadly can be abused. This is not a safe medication to play with for hallucinations or recreational drug use. Do not try this yourself. Talk to your kids. Get the Benadryl hidden in a safe place. I hope this has helped. Please share this, comment below, or reach out to me on social media, Dr. Larry Burchett. As always, stay safe, stay sane, do your part. I'll see you next time.